next week, it is the 2014 Taking Control of Your Health Fair at Independence Mall. Leading up to the event, we'll be talking to a few doctors about ways we can all stay healthier. And joining us now is Dr. Richie Smits, a family medicine physician at New Hanover Regional Medical Center. So, good afternoon. Thanks for joining us, Doc.
Yeah, nice to meet you. Let's
start with just strokes in general. What is a stroke?
So a stroke is kind of like a brain attack. Kind of like everyone is familiar with heart attacks. Your heart isn't getting enough oxygen. It's kind of a similar thing with your brain. Your brain isn't getting enough oxygen, whether that's because there's a clot in your blood vessel that's preventing blood supply to get to your brain at that time.
What symptoms? I know that there's some small things that are kind of telltale signs that we can all look out for.
There's a handful. The most common things to look for, it's an abrupt onset. It happens very quickly. It's not usual for the person themselves, maybe a family member. They might have weakness in one arm or one leg. Their facial structure might droop down on one side. They might not be able to speak clearly or might not be able to respond to you. Might lose vision in one eye or both. But those are the more common ones.
When we're talking about these symptoms, let's say a family member, you're at dinner and you notice one of these symptoms, why is it important to act immediately, even if it's nothing, to act immediately just in case?
Sure. It's important to act immediately because if a stroke is recognized and if it's a type of stroke that's a clot, it can be treated most of the times within 3 hours if brought into the hospital and recognized on a CAT scan or an MRI.
All right. Well, is there anything else that's important to know? Any kind of tidbits about strokes that the viewers may benefit from?
I would say one of the big things to helping in preventing strokes is just recognizing that managing your diabetes, high cholesterol, any heart arrhythmias or poor rhythms, and treating high blood pressure is very important in helping preventing a stroke.
Okay. Well, Dr. Smits, thanks for joining us today with New Hanover Regional Medical Center.